don't know us, we were founded in 1981 by Quentin Young, who was a physician, the chair of medicine at Cook County Hospital for many, many years. And in 1981, along with a friend of his, civil rights activist friend, John McKnight from Northwestern, started Health and Medicine to be a progressive health policy think tank in Chicago that would advocate for policies that really would improve the health of the public and not be attached to an institution or any organization that could tell it what to do. So we are perpetually independent and advocate on behalf of the public's health. What? Poor. Right. Right. Yes, our founding members, Linda being an early one of those, said our independence will guarantee us that we can talk about what we want, we can advocate for what we believe in, and we'll be poor. So here we are. We do it. We conduct research, we develop policy, we're fierce advocates for health equity. As I mentioned, please do look at our website. We do a lot of different kinds of projects. We have many things going on at any given time, and we would love for you to connect. So I want to say a couple of thank yous. The Chicago Community Trust and the Polk Brothers Foundation fund us to do this series, so I am forever grateful to them for their belief in our organization and the need for discussions like this around equity and health justice. So thank them. Thank you to SEIU for letting us use this fabulous space. It's really wonderful. I don't know how many of you have never been here before, but we love to hold forums here, and they are very generous sponsors. And thank you, of course, to our health equity team, Wesley Eplin, who many of you know, and Juliana Lopez, who's probably running around taking care of, oh, there you are, okay. So who really did all of the work to put this together and make this a success. So thank you. Okay, what else do I need to tell you? So today's the beginning of developing this health equity agenda that we hope to present to the 21 candidates, or however many are left at the end of all of the juggling. I was thinking about, as I put together my remarks, I was thinking maybe we should call it the People's Agenda for Health Equity, or the People's Agenda for Equity in Chicago, something like that. But we really want, participate. Tell us what you want. Are there any candidates in the room? We actually did have some candidates respond that they might be here, so don't be surprised and don't hold back just because they're here. So you're all sitting at a specific table right now. We are going to have table discussions. Please feel free to move around. There's food and coffee and probably tea and water in the back, and the restrooms are back there, so feel free to move about, and if you want to have side conversations out in the hall, and we'll have many breaks and opportunities to talk to one another. So now I think that's all of our housekeeping. Okay, so I want to bring to the podium our keynote speaker and facilitator for the morning, Dr. Rae Murray, who probably needs no introduction to many of you. But Linda's a board member of Health and Medicine and former president of Health and Medicine, former president of the American Public Health Association, longtime physician within the Cook County Health and Hospital System, and a lifelong social justice advocate. And I'm so thrilled to have Linda as my colleague and friend. And let's turn it over to Linda. Thanks.
Thank you. Will we have a show of hands from our high school students? Let me ask, are there people, how many of you are health professionals or work in our medical or public health system? Raise your hands. Okay, and then some of you didn't raise your hands. So the people who didn't raise their hands, and especially the students that we have in the room, this is really a session where we ask you to speak up and talk. We are at an interesting time, as Chicago politics always are interesting. This looks like it's going to be a more interesting mayoral race than normal, which is saying something for our city. And my role this morning is not to sort of list out what I think or what Health and Medicine thinks we should be demanding. And we should be demanding things. My role is to have a family discussion. That's what we're going to do this morning. We're going to have a family discussion about how the hell we get out of the mess we're in. And what can we do to get better? That's really what we're talking about here. Now, some of you work in other sectors. I know there are faith leaders in the room. Some of you are educators. Some of you may work in transportation or housing. So I in no way mean to suggest that those sectors are unimportant. In fact, you'll see as I talk that they are fundamental to what we're talking about today. What I want to do is challenge what most Americans think health is about. Because you can't have a health agenda if you don't sort of agree, what the hell are we talking about? Now, as an old doctor, you can imagine that everything looks like health to me, right? That's how we normally work. But I actually am an old arrogant doctor, and I actually believe everything we think about and talk about and work on is related to health. Human health and the health of the planet and everything that's alive on the planet. And I don't think that's a narrow notion about what health is. I think if you ask your granddad or ask your mother or your children what they wanted out of life, I think what every human wants is to be healthy, not individually healthy. Like, I want not to be fat. I want not to be fat, but it doesn't seem to work, just the want. In other words, I'm not talking about your individual health, though obviously that's important. I'm not even talking about your family health. You know, I want my mother not to have cancer. I'm talking about health and well-being. I want to wake up in the morning and feel good. I may be in a wheelchair, I may be not able to see, but I want to wake up in the morning and feel good. Feel good about myself, my family, my neighborhood, where I live. And I want us collectively to feel like things are good, and more importantly, they're going to get better. So health is sort of this ephemeral goal that I think all human beings have. I expect people who spend their lives in other areas to use language of that area. I don't expect a Frenchman to stand here and say in English, I want to be healthy. He's going to say it in French. And so faith leaders talk about a beloved community. That's cool. I understand what that means. It means healthy. Okay? Sports enthusiasts talk about an active sports program. Housing activists talk about housing as a basic right, that everyone deserves a safe, decent, affordable housing. So all of these human goals, I want the owls not to disappear. I want the lakes not to be polluted. All of these goals, to me, talk about health. A healthy planet and peoples that are secure in feeling that things are well and it's possible for things to get better. So when we think about health that way, when we approach the candidates who are applying for a job, that's what they're doing, by the way, right? They're applying for a job as mayor of our city. We need to be sure they're on the same page with us. Then the next question that we're going to really concentrate today on is, well, what do we need to be healthy? And this is my other global notion that I want to come back to at the end. Democracy is the most important tool that we have to gain power to change things. So in my mind, you can't talk about being healthy without talking about democracy and lining out the tools that are involved in that. Why? Because we need to have power to make sure that we don't go back to slavery. We need to have power to be able to end racism. We need to have power to address our inequitable tax situation. So in my mind, those are the two things that I think about all the time as what we need as human beings. If we want to be healthy, we have to have power. And in this day and age, the most important part of getting and maintaining power is democracy. So then where should we start? I actually think, and I rarely do this, is anybody here from the Chicago Department of Health? Okay, listen carefully, because I actually think a great place to start is Healthy People 2.0. Now, if I had written Healthy People 2.0, it would read differently, but that's okay. I think a great place to start is right there. So it's on the web. Go look at it. Now, you can't read it literally. You can read it and see what they're saying and know, they can't say this, but I'll say it, that there are lots of things that they wanted to say that they couldn't say. Okay? This is Chicago after all. So read it and understand that there's a filter there. But that's a useful place to start. And they will point you to other information, details, some of which you're all an expert in, different areas of it, that detail what exactly is going on in our city and surrounding area. So when we think about health, and when you're talking in your tables, don't think about it only on the individual level. Ask yourself what are differences between neighborhoods in our city, different sides of the city. I was at dinner last night on Taylor Street, and I overheard this one lady say, I don't understand nothing about the South Side. Well, actually, she didn't use that. I can't talk like a white person, I'm sorry. She said she didn't understand anything about the South Side. I'm saying like, yo, that's like a put down on the South Side. Right? But what are the differences, not only in individual neighborhoods, but in regions of the city? What's the difference between the city and the suburbs? What goes on in Cook County that doesn't go on within the city boundaries? And our state is totally fucked, right? I mean, we had an election. He hasn't taken office yet, but he's starting off with like the worst, except for Mississippi. I think Mississippi's still worse than us. But, we're in trouble in the state of Illinois in so many ways. What's going on in our nation? We don't want to spend a lot of time on that today. We'll be here forever. And what's going on in the world. So we have to think about all of those different levels of how human beings organize what we do. So you should pay attention. If you want your neighborhood to be healthy, you don't have to be an expert in everything, but you ought to at least notice that they're rioting in France. Okay? I'm not even sure exactly what's going on, but I know something's going on in Paris. Okay? You should be aware that the climate change conference is going on, and people from all over the world are demonstrating. You don't have to be an expert in climate change. But when you see that kind of activity happening, you should ask yourself, what is climate change going to do here in Chicago? It's going to have an impact. So being aware of what our goal is and understanding that we're all connected some kind of way is critical to making any progress on health. I'm not going to talk a lot today about the medical care system, but we're in trouble with that. I just want to point out a couple of things. First, we live in a country that refuses to acknowledge that medical care and health care, medical care is what we do individually with folks. Health care includes things that we do at the population level, like making sure there's not an Ebola outbreak. That we're in trouble with that, and things are getting worse. People are dying in this country from type 1 diabetes because for some mysterious reason, actually it's called greed, but for some mysterious reason, the cost of insulin, one of our old drugs, has skyrocketed. Same problem with asthma, but we have people actually dying that don't have health insurance and cannot afford the adequate supply of insulin. This is an unheard of notion. And so don't be fooled. I mean, we made some progress with the Affordable Care Act. I don't want it repealed, but it never was going to solve anything. I personally support single payer. But the point is, keep an eye on what's going on in the medical care, because it doesn't mean that things are all good. Maternal mortality, the number of women who die around being pregnant and giving birth has gone up. Most things, as an old doctor, most things I can honestly say have at least gotten a little bit better, okay, in my career. But this is one thing that's gotten worse in the 40 plus years that I've been in position. The number of women who die around childbirth, white, black, green, blue, worse for blacks, but has gotten worse. And if you care about health, you should be saying, like, what's with that? What's going you've noticed, because it has been reported in the press, that life expectancy is going down. Don't believe their answers. It's not simple, okay? It's not a simple answer about why life expectancy is going down, you know. Diseases of despair, which black people, we've been in despair forever, you know, so I don't believe their little solutions on what they think is going on, but the point is, the fact that life expectancy in the richest country of the world is going down is a sign that something is very, very wrong with our society. So we shouldn't ignore medical care, but it's just not even the most important thing about why people are healthy. It may be critical to you as an individual. If my appendix bursts and I don't get the appropriate medical care, I could be dead. That is true. But it doesn't really explain why, in the broad sense, Americans are in trouble in terms of our health status. There are other issues that are really related to health that we don't usually think of as health. And I think the Department of Health's report, which is really modeled on what we think in public health in terms of social determinants of health, tries to lay that out clearly. And so things about what goes on in the environment. Okay. Not only toxic things that go on in the environment, that's important. The Petco on the south side and southern suburbs. And it's not just about transportation. So again, we have to always ask ourselves, what do we really want? So you know we have these weird bikes, right? Divvy bikes, you know. And of course you know where they weren't put. This is not a surprise. I don't know why. The Tribune and the Sun-Times always do this like they discovered something. Oh, they're not in poor neighborhoods. And on the south side, which you may not know, because you may not hang out on the south side, on the far south side in Beverly, they had another company come in there. Okay. But the problem with transportation is not how the bicycles are distributed. Because if you live in Beverly and you ride, not very many people ride their bikes to the loop from Beverly. You'd be stupid if you did, you know? I mean, I'm sorry, you would be. And plus it's dangerous. But ask yourself, how is the transportation system set up and what is its purpose? How far does the L go south? And how far does the L go west? And how far does the L go north? And that'll tell you right away where the power lies in our region. Because the Chicago L doesn't leave the city on the south side. It does leave the city on the west side. And it goes way out of the city on the north side to service people with more power. So when we talk about health and transportation and the ability to get to jobs that are not in the city, or the ability to get to jobs that are not on the bus and L lines, which were built 70 years ago and the factories have moved, you have to include that into how we think about health and what we demand of the new mayor. Economics. We spend a lot of time talking about that. Poverty is not a disease. It's not a personality trait. So when I hear people say, oh, we have to consider the social determinants of health and poor people are sick. Yeah, poor people are sick. But it's not just because they were born poor. They're not poor because there's something wrong with them. You know, they're not poor because they didn't get a good education. That may be the mechanism by which we keep people in poverty. They're poor because someone oppressed them. Somebody made them poor. Okay, it's not like some of us are born with blonde hair and some of us are born with brown hair, and when we get old, some of us turn gray. Actually, I think all of us turn gray because some people, you know, use modern technology to hide that fact. So these issues, poor education, poor jobs, being unemployed, these are not personality traits. These are pathways, they're intermediary pathways that allow people to be healthy or sick. That's the other thing we tend to think of. We tend to think of these problems of, well, you're unhealthy because you're fat, unemployed, uneducated, black, and poor. Nobody asks, why is this mother on the north side healthy? Okay. It's not a deficit problem going on. It's a condition that's created by actions that we take as human beings. That's why democracy and power is so important. People are poor because someone took their work for themselves. That's what's going on. If you're making up beds in downtown hotels, you're working harder on any given day than I ever worked. The physical labor, the stress, the sexual harassment is worse than I ever experienced on the job. And what happens with those workers is someone steals the value of their labor. We sit here at SEIU. There is nothing in this country that was not created by human beings on the land. And we're a nation built on theft. First, the theft of the land itself, and the attempt to kill off all our indigenous people, the use of free slave labor. But even after the end of slavery, the things we make and what they're worth are taken. Why should you pay $1,000 for an iPhone, which is an inferior phone anyway? Why would you pay $1,000 for an iPhone when it just costs out $100? I mean, the materials in it are chump change. And the people that make it get chump change too. The social determinants of health are simply the midway path to creating healthy communities or unhealthy communities. What we have to ask ourselves are, what causes poverty? Not the fact that some people are poor. Why are some people poor? And who decides who gets to be poor? It's obviously not random, as we all know. When we look at education, Chicago is a city that's an expert in not only systems of oppression, and I want to recommend to you Andrew Diamond's book. Wesley will help me think of the title in a minute, but he'll tell me, I can't remember, but I remember it's Andrew Diamond. And we're also have a rich tradition of fighting back. We're a labor town. We believe in independence politics. We're an important cog in the civil rights movement's wheel. We're a leader in immigrant rights. So we have, on one hand, old systems of oppression that operate at an expert level, the democratic machine. But we also have a tradition of fight back. We have to start by saying what we want, a healthy city, and saying what we need to get there. So we had the first strike of charter schools in this city by CTU, victorious. But we can't forget the destruction of the Chicago public schools has been going on for over 40 years. And if you don't understand that history, you can't correct it. You can't change it. You can't educate people. So now we have cell phone videos, and we can prove to the world in general what brown and black boys have known for generations, that the police fuck with you, they kill you. They beat you up, they kill you. But now we have it on video. But the real problem we have is not just that we have a police force out of control. So we should consider, how do we control the police? I think a civilian control of the police is just as important as a civilian elected control of the school system. But the police are just an instrument. I don't want to say they're a distraction, but they're just out there. They're doing their job, which is to protect the people that are taking our money and have the power and don't want to. It's not a question of sharing the power. The power is not this. If you're 0.5% of the country, whatever that top 0.5%, that doesn't mean you get to share power. The question is, why do you have any at all? You're only 0.5%. So at your tables, don't just say, I want a turkey for dinner. It's nice to have turkey at Thanksgiving. If you can't afford it, if someone gives you a turkey for Thanksgiving dinner, that's a nice thing. But that doesn't help. I know my daddy used to always say, yeah, what happens the other 364 days of the year when you can't have food? Right? So don't just say, we want the 6 mental health clinics to reopen. The 6 mental health clinics weren't enough to begin with, and they weren't that good when they were open. So say what we really need to be mentally healthy. I have not gone to see a psychiatrist ever. Some of my friends think I should, and they're probably right. But trust me, I would much rather be in a position where I didn't have mental illness and stress in the first place, rather than trying to find someone to help me because folks have stressed me out. Be critical. Be thoughtful. Think. We're not even in a box. We are brainwashed. We have no clue what's going on in the world. So when we say silly things like the mayor is about to say, I guess, we should eliminate the COLAs on pension if we want to do anything. That's nonsense. What do other places do? How can you fund the pensions the other way? How much taxes do the companies that work in the Chicago area pay? Any mild analysis of that would indicate that corporate taxes are way below what they should be. We actually have a corporate welfare country. We supply air that they're dirty. We supply water that they make filthy. We build roads to the factories and offices and away. We upgrade airports so they can fly around the world. That's stuff we do with our public dollars. Those are resources we could use in other ways. So we have to go a little bit deeper than what's in the newspaper. Yes, we have to control the police, but we should really be asking ourselves, what would a just Chicago look like? What would it look like in our city if we had justice in every aspect of life? So, as we think about the economic mechanisms that the mayor has put in place, and not only him, but previous mayors, the TIF funds, what was it meant for? Do you know in Illinois the TIF funds were designed to improve public health, among other things? It actually says it in the statute. But it's turned into a special patronage fund for friends of whoever's in power to build little malls and stuff so they can make more money. There's a problem with that. The way we try to finance infrastructure improvements, how we think about economic development. These are things that go to the core of how Americans think and act. And we get confused because of all of the shenanigans that goes on in the media and in our newspapers. But if you just go back to basics, things your grandmother told you, things your 5-year-old will ask you. Why? That's what the 5-year-old would say. Why? Why is that man on the street, Mommy? Why is he asking you for money, Mommy? If you remember those basic things, then I think we can arrive at a different kind of solution. In the Department of Health's goals, they have an interesting mixture. Because, we get confused and we say we have to, when you write a grant, you have to have a measurable objective. How do you measure health, You have to have a measure. Well, if you have a measurable objective, you don't get very far. But there are some things in the Department of Health's goals that I think are very interesting and I want to support. First, they would like life expectancy to go up. I'm going to call that a proxy for better health. I'm ignoring all the other stuff, that they had down there. Decrease obesity, prevent hospitalizations. All those things are nice, but they have them there because you can measure them. I have to hear this, and this is one thing, this is one ask I have of the new mayor, It's a very simple ask as a professional public health person in his city or her city. The Department of Health has decreased discrimination. I would love it to replace that with just eliminate racism. And then you could talk about other kind of discrimination. I'm not sure I found racism anywhere, but it might be there somewhere buried. Understand that every policy we do impacts health. That's in the Department of Health report. Institutionalize health in all policies. You have to recognize revolutionary slogans when they appear, because they don't usually announce themselves. So I want to lift that up. In fact, if I had to pick one goal from the Healthy People 2.0, that would be it. Institutionalize health in all policies. That's code for, motherfuckers, we're going to make this city healthy. Another thing that they have as part of that is to have a trauma-informed city.
Thank you.
Well, it's interesting, because this is like a new slogan. See, when you're old, you get confused and irritated with new slogans. So when they first started talking trauma-informed care, I'm saying like, where were these people? Where have they been for 400 years? You know, that's what oppression is. Trauma. Everything that we're talking about, not being healthy, is traumatic. It's an abnormal state. So the way I interpret that, trauma-informed city, and secret code for saying, understand we're getting our ass kicked. And if we want to have a healthy city, we got to stop that. The first step is knowing that you're getting your ass kicked. That's the first step. So what are we going to ask you to do now? We're going to ask you to think about what we need to be healthy as a city. Not what we needed to be healthy as a city 40 years ago, what we need today to be healthy as a city. And that means you have to think outside of the city limits. We've lost hundreds of thousands of black people in the past 20 years or so. Think about what that means. Here's a public health measure. In 1950, the difference between black women and white women who died from breast cancer was basically no difference for all intents and purposes. Today, over time, the differences got wide. Now, black people didn't get more oppressed. Well, you could argue that maybe we did. But anyway, the reason why is not because black women were suddenly more oppressed or that white women suddenly got more freedom. What happened is our ability to treat and cure breast cancer improved. And as often happens with new changes, not everybody has equal access to that. So white women in Chicago were able to take advantage of those new improvements, and their mortality went down. Black women in Chicago were less able to take advantage of those improvements, and our mortality didn't go down. In the past 8 or 10 years, when we've looked at this, the gap looked like it was narrow. Well, the gap is narrowing. Okay, a little bit, not very much, a little bit, 10%, 20%. But what happened? All it takes for that to happen is for 20 black women who died from breast cancer before they died to move to the suburbs. We had so many black people move to the suburbs that that's what happened. So we could be in a situation in 10 or 15 years where everything you look at, smoking rates, cancer rates, unintended pregnancy, diabetes, anything you want will improve in the city of Chicago. As it gets richer and whiter, the health indices will improve. That's not what we're talking about, is it? We're not going to be happy if 15 years from now all the numbers look better because the city is whiter and richer. That's why you have to think outside of the boundaries of the city. When I came to Chicago, the port of entry for immigrants was inside the city limits. That hasn't been true for 25 years. The port of entry for immigrants, new poor immigrants, is outside of the city limits. So the first thing we have to do is have a clear understanding of what's going on, not only in Cook County, but in our surrounding counties, where 80% of the population of this state lives. And we have to begin to think about, how do we gain power on that regional basis? How do we look at equality on that regional basis? Because where winos lived when I first came to the city, I can barely walk down the street now. You got $1 million homes everywhere. So think about the region that we're talking about. And think about how we get from where we are now to where we want to be. Why are we challenging people running for office? Why are people running for the mayor of this city required to get so many more signatures than any other office? Well, I know why. It's so that independents can't do it. Progressives can't run. That's why. And why are we allowed to challenge? Why can't I sign more than one petition? You can't do that. It's invalidated. Well, why not? Suppose I want to have 21 choices. You know, I'm not voting for the person when I sign their petition. Why do you have to register to vote? How come you can't turn 18 or 21 or 31 or whatever, and you just automatically vote? So think about the tools of democracy. Why is the budget passed when no one gets to look at the budget? Half the time, the councilmen don't look at the budget. They get it like a couple hours. Why do we allow that? Why don't we have discussion about how things should be budgeted? Why don't we have a process to collectively ask ourselves, what schools need more money? When that's happened, I'll say this, white parents on the north side have consistently said, we don't need this new addition you're trying to put in. This other school over here needs more money. When you make things transparent, most of the time human beings function in ways that we're proud. So your task today is to craft something that goes to the real root causes of why people are not healthy. And to do it in a way that dumb politicians can understand. That's the real challenge. So you gotta be talking to like a 3-year-old and explain to them. Okay. Bring in all the things you know about. Can someone rent an apartment in this city? Where can my high school kids safely go and hang out? Where is that possible? I live in Hyde Park on the plantation, where, you know, we have the second largest police force in the state in Hyde Park, the University of Chicago Police. And every Halloween they go crazy because the kids from the south side, there's nowhere else to hang. They come into 53rd Street to hang out. Where else can you do that relatively safely? On the south side, not very many places. Why don't we have more places for that? Why don't we have situations where old people like me can make it across the street? In the Loop, I'm in trouble because I move slow. I never realized this until I got old, I tell you. Those street lights, they like boom, and they count down like those are not seconds, I'm gonna tell you right now. They count down, and you know what? The biggest streets count down the fastest. The little short streets, they take, it's just amazing. Why do they allow that? So we need some old people to look at the street lights. That's a tool. It's not an end, it's a tool. So this is a tricky problem we have, to express where we want to go, to do it in enough detail that this is something you could do in the next 4 years as mayor, okay? And to understand what we need to build and maintain and organize the tools of democracy in order for us to gain more and more power. It's not going to happen all at once. The more power we gain, the more we're able to change things so that more of us can be healthy. Thank you. Are you setting this up or am I setting this up? Okay. No, well, I want to say one thing. We did ask for testimony. This is what we hope happens the rest of the day, but we want to honor what we put out to emails. We're going to have, you're going to set it up because I'm not sure how the tables are organized. We're going to have some table discussion. We have some grids to help guide your thinking and fill out. We'd like to collect those grids, so we have everybody's thoughts. So even if something doesn't get discussed at your table, to the extent you would like, you'll be able to write it down. We're going to collect all of that up and put it together. But we asked if anyone wanted to, quote, testify, like a prepared short testimony. I think 2 people signed up. So we want to honor, if those 2 people in the room, we want to honor you by having you come up here and testify, and then we'll go to the tables. All right, either one of those 2 people, I don't know who they were, in the room? Yes. Do you want to, okay, anybody, was the second person here? Well, then you all need to come on up and testify, and then we're going to have Wesley talk about how to do the tables.
Thank you. Good morning, everyone. Thank you for the opportunity to share with you today. I'm Dr. Janice Phillips, Director of Nursing Research and Health Equity at Rush University Medical Center and Associate Professor in the College of Nursing, and also a Robert Wood Johnson Health Policy alumna. But I'm coming to you today as a concerned nurse who has dedicated my career to eliminating health disparities. Any health equity agenda would be incomplete without ensuring that environmental justice is included as a health priority. In recent weeks alone, we have been reminded of a number of adverse environmental conditions that are plaguing minority communities right here in our own backyard. To illustrate, on October the 28th, 2018, the Chicago Sun-Times displayed a map using EPA data outlining areas in Chicago that bear the heaviest burden of pollution. These findings were a part of a Better Government Association's report that revealed the greatest exposure to air, land, and water pollution occurred in neighborhoods with large concentrations of African Americans and Latino residents. Residents who lived in areas deemed to be Chicago hotspots, including Little Village, Pilsen, and the far southeast side, are disproportionately impacted by toxins and other environmental hazards. These findings resonate with findings from a 2015 study conducted by Dr. Joel Afric, President and CEO of the Respiratory Health Association. Dr. Afric reviewed hospital data and found that 8,848 children in Chicago went to the emergency room to be treated for asthma in 2015. 63% of these children were Black, 22.5% were Latino, compared to 6% whites. These are our children who reside in communities with large concentrations of Latino and African American residents. But behind these statistics are real people who are living in polluted communities every day. Chicago resident Gina Ramirez reported being afraid to even open her windows or to let her 4-year-old child go outside to play because of the high presence of toxic dust. And where does she reside? Chicago's far southeast side. On Sunday, November 18, 2018, the Chicago Tribune reported that environmental policies designed to protect minority areas have shown little progress. The Environmental Justice Office acknowledged that they had not hosted any community meetings in an environmental justice community in 2 years. This failure to inform and support timely community engagement creates distrust and has the potential to expose communities to hazardous materials and other environmental pollutants. So in conclusion, I encourage those to ensure that the issues of environmental health and environmental justice are included in the health equity agenda for Chicago. As we move to elect a new mayor for our city, it is an imperative that our new elected official institutionalizes health in all policies, but also stands firm in upholding the tenets and principles outlined in the Executive Order 12898, Federal Actions to Address Environmental Justice in Minority Populations and Low-Income Populations. For without a commitment to this regard, health equity will not become a reality for those most in need. Thank you.
Good morning, everybody. My name is Anna Yankolev, and I am a researcher for the UIC Center for Healthy Work, and I am currently pursuing my master's degrees in public health and business administration. I would like you all to take a minute and imagine a restaurant worker subject to daily harassment. Her employer refuses to give her tips at the end of a long shift due to her documentation status, and therefore cannot make ends meet. Consider the temporary warehouse worker who is not given proper training and is injured on the job. Since his employer of record is unclear, no one is going to pay his lost wages or workers' compensation claim. Envision a home care health worker who is forced to work unpredictably long hours, but without health insurance cannot care for her own sick child. Picture the man hired on a street corner to do construction work for the day. He will never earn enough to save for retirement or his children's education. These workers share increasingly common stories due to profound changes in the globalized economy. The rise of contracted, temporary, and low-wage jobs that lack benefits, stable schedules, or opportunities for advancement has led to a massive increase in precariously employed individuals. And I want to echo what Dr. Murray was saying this morning about how a lot of times we think about work and health. When we think about it, we think about whether or not you have a standing desk or whether or not you have an apple for lunch. But this is more than just this clinical one-to-one interaction. When we think about work and health, it is broader. It is about opportunity. It is about resources. And it is about feeling like you have a job where you can feel like things are going to get better, where you're not just trapped in this cycle of poverty and work. Tens of thousands of Chicagoans work in these types of jobs where the conditions of their work and the resulting opportunities for health that they have access to make them more likely to have an unmanaged chronic condition, make them more likely to get sick or injured on the job, make them more likely to miss work for being sick, that's absenteeism, and its flip side, presenteeism, going to work while you're sick. And talk about public health issues. Going to work when you have the flu is not good for anybody. For many of these workers, traditional workplace wellness approaches don't work. Having a healthy vending machine won't help you eat healthier if you don't make enough money to afford the food inside of it. That's why it's important to ensure that all workers have access to the resources they need to lead healthy lives, including a living wage, health insurance, retirement benefits, paid sick leave, stable schedules, and protection from discrimination, harassment, and exploitation. In order to advance health equity, the issue of precarious work must be addressed. That's where the Center for Healthy Work comes in, a NIOSH-funded Center of Excellence for Total Worker Health at the University of Illinois Chicago School of Public Health. The Center for Healthy Work documents the effects of the changing nature of employment and the experiences of community members engaged in precarious work. We are building a culture of understanding around how work impacts health at the community and organizational levels. We identify, build upon, and promote best practices for policy change at local, state, and national levels, and collaborate with other partners from other sectors, including worker centers, labor unions, social justice groups, government agencies, social service providers, and employers to elevate promising practices that better equip workers, their families, and their communities to advocate for and achieve healthy work. We hope that this forum and the collective ideas that will arise will help advance policy recommendations, innovative collaborations, and partnerships, and effective, sustainable initiatives that make healthy work a reality for all workers. Thank you.
We're gonna do a report back now. So we're gonna pass the mic from table to table. How about we do it this way? Why don't we share one or two ideas from each table, and then once we've got to all the tables, we'll pass the mic again. We've got a good amount of time right now. We have about 40 minutes. I also want to invite folks, if you have direct responses to someone's idea or something to add on, to feel free to kind of raise your hand. We'll get a mic to you so you can share those ideas and responses as well. So we can make this kind of a little bit more conversational. So who would like to start? Who has an idea that they really like to share with the room right now?
Can you be specific on how much you want to share because you can talk for a long time?
You know, maybe try to, wrap up an idea in a minute or two. we can be flexible on that, just to say, here's the basic problem that we see, a little description, and then some of the ideas that you generated for kind of ameliorating the problem. Who would like to start? Corner.
Yes, stand up. Voice of the future.
Hello, my name is Jayla Campbell. We're also talking about CPS schools and how our lunchroom our food needs to be better. Yeah, so the first one was describe the problem, nasty food, poor quality. The way we can, the solution was more surveys on how the students feel for the food. And just because for example, we go to school Monday through Friday. Monday and Wednesday we have pizza. Every Monday and Wednesday we have pizza. And then Thursday can be a granola bar and a peanut butter jelly sandwich. Friday we get the juice and dressing. And it'd be horrible, nasty. And so we don't eat till we get home because breakfast is nasty, lunch is nasty. We don't eat till 6, now we're hungry. And we tell our parents, Mom, Dad, I'm hungry. Why do you eat at school? It's nasty, we don't like it. And so, we really feel like we need more money. More good food.
Thank you for sharing that. Who's next? Who'd like to share a problem and a potential solution or two? Well, we're going to collect those note sheets. We hope to collect them and share them with us to take them down. We also do have note takers taking notes in the room. Yes, in the back. Just two at this table.
Oh, you go first.
Hi everybody, I'm Anna. We talked about a bunch of different things at our table. Most of them were under the umbrella of structural violence, which is basically means how different policies and programs hurt people in different ways, whether or not that's direct violence or institutional violence. So one thing that we talked about a lot was how schools are not funded equitably, how a lot of schools on the north side have a lot more resources than schools on the south side. So one solution that we talked about was having a publicly elected board of education that has student representatives on it, so that a student voice is brought to the table, and that funding for schools, how schools collect their funds and disperse their funds, needs to be transparent and publicly available. And we also talked about larger, beyond the local policy, how things like a progressive graduated income tax could be used to, or a LaSalle Street tax on exchanges can help fund those kinds of activities. Anybody else want to?
Oh. Hi, my name's Helen Ramirez Odell, and I'm a retired school nurse. I retired a little over 7 years ago after 44 years in the schools, some surgery in the hospitals before then. But I'm very distressed as to what is happening with school health. The needs are greater than ever. Some years ago we had the law passed that all children are entitled to a free and equal public education. So we have not only the so-called normal healthy children who have all kinds of issues, but also children with very complicated and multiple health problems. When I was working, there were about 300 certified school nurses serving 600 or so schools. Now there's barely 100 nurses, maybe up to 110 certified school nurses serving over 500. They are assisted with some LPNs, but because so many children need medication, need diabetes care, many kids with diabetes do care for themselves. They need minimal monitoring, but many of our kids in school need nursing service every day because of their youth or their disabilities. And the board's solution to that has been to outsource, to have a multi-million-dollar contract with a private agency, profit-making agency, that brings in a revolving door of nurses who don't know how to function in schools, who don't know the students. There have been mistakes, tremendous dissatisfaction. Some of you may have been reading the Sun-Times. A group of parents under Raise Your Hand have really complained that their child's had 20 nurses since school opened in the fall. One parent left her job so she could come to take care of her child every day. She has a kindergarten child. And what's the board's solution? Now, instead of hiring more certified school nurses, more LPNs, we should have a certified school nurse full-time in every school, and additional nurses depending on the population and needs of the school. But now they're making a contract with about 6 additional temporary agencies, which just trivializes the work. And of course, if you get a full-time nurse in a school, that nurse should be available to all the students, not just the ones with special needs. All kids need services of nurse, both for both physical and mental health needs. We need more social workers too. So if, Illinois, we're at the bottom of the barrel when it comes to money for education, but we desperately need more nurses, more social workers, more clinicians, so our children are adequately served, and we need a good public health program in the school so we can develop a healthier society.
Who else?
Hi everyone, I'm Stephanie Becker. I'm from the Shriver Center, and we had a wonderful discussion here at our table with people from all different faith community, students, social workers, so medical legal partnerships. It was really wonderful. We could have talked all day. The one thing I'm going to talk about though is, so the problem we discussed a lot about was disparities in health outcomes and sort of the way the pastor here said is a death gap. And we've seen that in actually the Healthy Chicago 2.0 publication, where it shows your zip code determines your health outcomes, which is unconscionable. So we talked about at the community level, there's some really great programs here in Chicago, a youth service corps, where actually getting youth involved from the earliest, from elementary school to high school, and getting involved in screening for chronic diseases, and getting them mentored by medical students and by doctors. And he told a story of a youth actually helping identify someone who at that moment was having a heart attack, and it helped change a person's life and also his life, because he could see what a difference he was making. So doing more programs like that, matching up youth with service programs in the medical field, so that it encourages diversity in the medical fields here in Chicago. And another sort of possible policy solution here in Chicago is bringing the city and county health systems together. There's so much potential there, and the hospitals here in Chicago, there's so many resources. So bringing both the city and the county together to help the students in schools, and then on a sort of state and national level, making sure there's health care for all, including undocumented immigrants, and whether we want to call it single payer, Medicare for all, whatever it is, that would be the sort of state and national solution.
Who else has an idea or more than one idea they'd like to share with the room?
Hi everyone, I'm Julianne Bigley, and I'm with the Heartland Lions Health Board. Our group was talking about several different things, and it was about really focusing on equitable access to primary care services around the Chicagoland area. And really bringing care out into the community, because we have healthcare deserts here currently, right now, and we realize this. And we really did think about this across, again, thinking more broadly across Chicagoland, not just within the city. I mean, frankly, there are healthcare deserts across the country. So it's really a national, you can start to break it down, but just in the Chicagoland area. Certain things that we discussed about that were both, so there's geographic access, needing to be able to bring care out into the community, that's quality care, having adequate funding sources, so it's not piecemeal or incremental, which is what it is right now, whereas we're relying on charitable or nonprofit entities and others. You need to have a consistent access that's coordinated care for all. And that level of intervention, it takes many stakeholders, but it ultimately needs to be a governmental, so both at the federal, state, local level to have that consistent funding. One of the things that we discussed was having what primary care means and really thinking about as an expansion to think about mental health services, dental services as a part of that, and especially that mental health services gap. It's just not there on that access. And particularly when I volunteer work with Heartland, we see that with homeless participants, multi-chronic, multi-symptomatic, and being able to have that coordinated mental health services is this critical component about the health, and frankly, supportive services that move around that, because you start thinking about health, it's not just the health, it's about having housing, right? There's a much broader thing about coordinated services, but to some degree, just starting out with primary care services and addressing those gaps are really important. A couple other things that we talked about were also about providing incentives for healthcare clinicians to provide primary care services and awareness, both in terms of the education and realizing the problem, but again, providing incentives to provide these services out in the community. There are some that exist, but let's expand upon that. Thinking about also how do we leverage, in the absence of having coordinated city funding and federal funding, things like new markets tax credits, TIP funding, other things, because you have to provide a sustainable financial model to support these services. And for example, the organization I'm involved with, that we leveraged with the bank new markets tax credits to be able to open a center in Englewood, 5501 South Halstead, and it was really done through that model. That it's provided incredible services to the community, but we need to be able to scale that. And you can't just do that one funding at a time. I'm just thinking the other things we talked about too, or how do you leverage, again, a couple other things. One is that it's not just, it's one having healthcare in the communities, but also how do you access that care? So thinking about transportation and being able to, and there's both in different types of patients and stuff, so there's both about transportation access can be leveraging telemedicine, but it's also local services to help get patients to that coordinated care if they can't access that. So it's expanding public transportation, but it's also transport services to those that can't afford to access that. So I think those were sort of the general things that we talked about. Would there be anything else that I missed? Okay, great. Thank you.
If you want to sit down, okay?
I had to check what time it was, because I need to say good morning or good afternoon. Good morning, friends. Hi, I'm Vincent. I'm an organizer here at SEI Youth Healthcare, so I could not say what I'm about to say. So it's so good to have you. If nobody's welcomed you to the space, I guess I'll take that privilege to welcome you to our building. But long story short, I mean, we had lots of conversations, and there are lots of policy recommendations that I've been hearing. A publicly elected school board, I think, will be great. I think this person kind of mentioned affordable housing issues. So let's talk about rent control, what that might look like. I heard about, health deserts, right? And so what that would look like to protect our safety in hospitals. So just as an organizer, we're going to have issues, and we've always had issues, right? We've always had problems. And I hear just kind of overhearing just at this table, but kind of hearing some stuff, around the space. You all have ideas about how we solve our problems, right? And so as an organizer, what I would just challenge and encourage all of us to do is, this one voice is powerful, right? And this one solution is great, but what it would look like, not for that individual voice to have all these great ideas, in her head, but to what? You already know, to be connected with another voice, right? And so that those two people begin to talk about that. If you haven't joined an organization, so this is one, this is a policy research group, right? But what does that look like, to connect with, I heard a pastor was here. What does it look like to connect with the faith community, right? What does it look like to connect with labor, not just on policies, but then of course we have to then back that up with people power, right? And so really the chief solution, and I heard a keynote say it as I kind of yield, there are people making decisions that essentially keep people poor. And so if you can ever identify the decision maker, the solution, no matter how varied it will be, because it'll need to adapt over time with the solutions to our problems. It is, how do we get decision makers through our people power to do what we want them to do, or to stop doing what we want them to stop doing? That will forever be our solution. That will forever be, our concern to fix what we need to be fixed. And we do that in coalition. And so when I was talking about the various people and entities and groups here, if we all got together, and I'm just so glad that we have a member here. I'm not gonna put her on blast, I don't know if she wanna talk, you know what I'm saying? But just what it'll look like for people who are directly rooted. And I love this little sheet. So I give kudos to the sheet. I mean that. I don't say that. It really was good. So, who was most affected by the issue? And so one thing I just want to challenge again as organizers, we never want to get elite. We never want to think that we know our problems more than the people who are directly impacted. And so that's the whole so that's why, so kudos to that sheet. So you always want to have that at the core. Because anything about us, right, that does not come from us and not for us, will never solve our problems, right? So you always want to make sure that that column is connected to any policy or any recommendations that you have. And then I love this last column. What groups need to be at the table? So we need to look at airtime. And so as I'm yielding, as a man in this space, but I gotta do it as an organizer, how much time are you taking up, at the tables, right? So you look around, there's 10 men at a table, and you don't have a woman, you need to think about who's not at the table, right? Like, is there a poor person at the table, right? Is there somebody who's differently abled at the table? And so this is a good guide, but again, just as an organizer, let's not let it just stay here, and let's just, we're always in 7 meetings as an organizer, sorry, and so move that from not just in your have your think tanks and do that, but then move that when you all decide on what we need to do, whatever the we is, do it in people power. Go to your elected officials. If you vote them in, you can vote them out. So we just came from midterm, so we have that power. And we need to get in streets. It's the time. So if our opponents are in streets, we need to be in streets, right? And so that's what I would recommend as a permanent solution to any problem that we face. It's so great to have you.
Thank you so much for that, and I want to give credit to Juliana for developing.
Dr. Murray was the too.
You drew it up. So I want to go back to a question we had related to this table right here. We had a question over here.
This is in response to the expanding primary care access, and I'm a preventive medicine resident at Cook County Hospital. I work a lot in the sector of providing cancer risk prevention services, in particular mammography, and addressing that death gap that was brought up that Dr. Ansel just wrote about, and the whole system, and he wrote in the book County about the breast cancer disparities. So what we've done at County, what we did as an initiative at the system level was we hired a bilingual patient navigator, so someone who can communicate with these community members and navigate people to these services that are necessary. And she was not trained, she had no credentials, she was just an interested breast cancer survivor. So being able to find people who are invested in this cause and communicate to people on the community level that these services are important to come in for primary care. And we also discussed about expanding out that network to churches and places of worship. There's been some research about hairdressers promoting mammography screening with their customers. So those might be other avenues to explore in terms of expanding primary care access and access to services that are necessary.
Thank you very much for that. Someone over here. Yeah.
Good morning, everyone. I'm going to try to, we talked about a lot of different things, but I'm going to try to, in a very organized, succinct way, report back. We looked at kind of the overarching problem as the city just repeatedly disinvesting in, disinvested communities and repeatedly investing in, predominantly more affluent communities. So we saw that as kind of the overarching problem. And we dug a little bit deeper. We talked about how in certain communities, there just isn't really safe spaces for community engagement, for, recreational activities for community youth, things of that nature. So we talked a little bit about, expanding schools that are still open, beyond the school hours for community programming, as well as the different field houses, part of the Chicago Park District as well, and expanding those hours for community engagement and activities and providing safe space for community youth. We spent a good amount of time talking about our tax structures and how they should be redistributed to promote equity for all of Chicago. And specifically, we talked about tax structures that would reward businesses for opening new businesses in communities that do require more businesses, grocery stores, things of that nature, as well as tax structures that will help longtime community members not get pushed out of their communities. We know that the city has a housing plan. We want to make sure that that housing plan reflects the needs of everyone. And then we talked about a livable wage or minimum wage, and Margie said that the language that's used now is a thriving wage, and we want to make sure that that minimum wage or thriving wage in Chicago definitely helps families not get pushed out of Chicago, because as we all know, it's getting more and more expensive to live in the city. And then my response to that was, well, how do we make the city more affordable so we aren't constantly trying to raise the minimum wage to a livable wage? So there's just a lot of work that has to be done there. And we talked about looking not so much at tax structures from at a city level, but more of a regional level, like the county, because to Dr. Murray's point earlier, people are getting pushed out, so they're moving to the south suburbs. And so when we talk about investment, we should really look at it at a regional level, and we talked a lot about just, an easy thing to get people to work around or work together regionally is transportation. So that was some of the other things we talked about. And I think we have a lot to learn from other countries. We mentioned looking at other countries, doing a comparative study, because other countries are doing a much better job of, the way that they provide services to their residents, is really implementing a health and all policy approach. We talked about Germany, where some countries provide college education free of charge. There's minimum vacation and maternity leave. Some countries, I think the minimum vacation is like 4 weeks, and that's mandatory across the country. So we definitely have something to learn from other countries as well. We talked about affordable childcare, and access to reproductive health care that is non-religious, because then there's restrictions, right, when you are receiving reproductive health services from a religious or faith-based institution. We talked about a lot of other things. They're all noted here, but if you guys want to mention anything that I forgot, please feel free to. Thank you.
I wanted to respond real quick to the taxation piece, because I think it's such an important piece. Illinois is the 8th most progressive taxing state if you consider all state and local taxes together. So there's a report you can look up called Who Pays by the Institute on Taxation and Economic Policy, ITEP. Who Pays, and you can find by state, they took all the state income taxes and other taxes, as well as the local taxes, and compared the states. With the 8th worst, we tax our poorest folks at the hardest rate in terms of percentage of income, if you consider all state and local taxes together. And the high local taxation is related to our flat income tax at the state level, because we don't have enough revenue to fund services. The share that we get from our states at the local level is not enough, and so what do our local politicians do? They raise taxes, right? Which are going to be regressive in nature. They're going to hit people, working people, people living in poverty at the highest rate. So thank you for raising it up. It's such an important issue, is our taxation, because that has to do with how much money we have for services and the degree to which our taxation could help level the playing field. We have more comments over here. Yeah, we'll bring the mic over. Oh, we have one over here.
We could go 1, 2.
Sorry.
Deanna's gonna get her steps.
Hi everyone, my name is Kate Nitland-Har. I work for a human centered design firm called Greater Good Studio that works with the public sector, and I just wanted to draw on a couple threads that had been raised by the last table representatives in the spirit of both working together and making the city more affordable. Our table talked about a lot of things, but we also focus explicitly on affordable housing as it relates to health. And so we talked a lot about solutions that have been raised at last night's mayoral candidates forum on affordable housing and equitable development that was put on by the Chicago Housing Initiative. So I know I was able to have the privilege to attend, and I learned a lot about different policies that are being proposed in the realm of housing. So lifting the ban on rent control, one-to-one replacements, land trusts, addressing lead, approving real estate tax rates, all sorts of things I had never heard of coming from more of a health background. And so I just raised that to say that a lot of the solutions will come in this room, but a lot of the solutions will come when we align with other movements that are experts in some of the work that we all care about.
Thank you.
I have a question on a different topic.
Good question.
Okay. A couple, Dr. Murray, you raised the issue of breast cancer and how minority women and those of low income are so adversely affected. And I do have a question. We know that mammograms are wonderful, but they do miss a lot of cancers. And the most common reason I understand is that women have dense breasts and the mammograms can't detect the cancer in them. We got a law passed in Illinois in May. And it's the Breast Density Information Act, and it requires that women who have dense breasts be notified they have it, so they can talk with their doctors about getting ultrasound. And I also understand that Illinois is one of the few states where insurance is required to cover that ultrasound. So my question is, now that we have this wonderful new tool with bipartisan support, which rarely happens in Illinois, how do we get it implemented?
I think it's a good question. Dr. Murray said she's going to close today, so I think she might answer it at that time. Right here from this table over here.
So, hi, our group, I'm Rachel Rubin with the Cook County Department of Public Health, and we chose a couple, and the one we're going to talk about here is housing or housing equity. As the sector policy area, and the overarching problem within the sector is the lack of affordable and healthy housing for all. So in terms of defining or describing the problem, certainly at a neighborhood and city level, that there's lack of affordable housing based on, historical imperatives with redlining, with inability to get affordable mortgages, disinvestment in communities that have poor housing stock, and obviously, the underlying racism that has created huge segregation in Chicago, really from its origins as a city, and how that's perpetuated today. So all of these things still permeate in terms of creating major problems with housing. On a city level, also, that certain communities don't have the same level of access to transportation, or people are being pushed out of it. This has been mentioned, or people are moving out, families are moving out to the suburbs. Also the communities, there's disinvestment in communities, so not only does it affect the housing availability, but people can't even live in those areas because they don't have access to grocery stores and transportation and good schools, and so they're choosing not to live in those neighborhoods if they even have a choice. So possible policy or other solutions, one is rent control. as one thing that is being pushed back, obviously, from the real estate lobby, to allow a certain level of fair rent control. Also, apparently there's some state legislation that needs to be repealed in order for municipalities to allow rent control in their communities, whether it's the city of Chicago or suburbs or central Illinois or wherever. And so we have to work on legislation, probably all through the entire life cycle of legislation, through federal down through state, county, city legislation. But we need to repeal things that are in place right now. In terms of the city, there's this,
Affordable requirements ordinance.
The affordable requirements ordinance that requires that apartment buildings that have above, I guess, 10 units, that they have to provide a certain amount of affordable units, but the kind of affordable units that they're providing are really ones for like students or studio apartments and not really for families. They can have 2 or 3 bedrooms, so and then they also need more units, and then there's a certain way of opting out. You don't have to provide affordable housing, you then give money into a fund, and where does that money go, right? Let's see. Also, just the idea of removing the stigma around, people that get housing subsidies. So the idea is that you should know whether your neighbor gets a subsidy or not. You should all be living in safe, healthy housing and affordable housing. Let's see, what else do we say here? Okay, then I'll go to the next thing, is who's most affected by this issue? Obviously, low-income families, children, those with disabilities, people on fixed incomes, seniors, people who need wraparound services like those with mental health issues or other physical other abilities. And so what groups of people must be at the table? I mean, certainly advocacy groups for the homeless, advocacy groups for fair housing, clergy. There are a lot of churches and faith-based organizations that run housing for low-income individuals, so they should be at the table. The Chicago Housing Authority, planning and zoning people, public health, education, government, basically everybody should be at the table. But certainly those people that are impacted most by the housing crisis.
Thank you very much. We can have one more table back here we haven't heard from. At least one more. Back.
Hi everyone, I'm going to try to keep the points of overlap brief, right, since there's so many wonderful things that have been said already. One of the big conversations that got it started for us was just acknowledging that crisis intervention in itself is siloed, right? So we don't really take an opportunity to look at the many possible points of intervention in a community. And the fact that if someone, for example, the example that was brought here was child protections and welfare, right? If there's deficits in that system, it's structurally responding to other faults in other places elsewhere. So just taking a look at holistically, what could we be doing to lift up the entire infrastructure that families depend upon? The other point that we really spent a fair chunk of talking about is there's policy making, but if we take a step back and even take a look at what access a normal community member, connected or not connected to an organization, has to actually be able to directly voice what's impacting them, and the solution is very slim to none. And that's the co-option of power that has directly impacted the majority of communities that are not at the table. And so we talked a lot about what does accountability look like in terms of, for example, the city council. And Wesley raised the example of some basic rules on quorum that exist, but how do we actually get our folks to be able to have a seat at the table to create the policies and solutions that they already have envisioned and just need the seat to be able to create. The other conversation towards the end, I think, is just a point of push for us, right, is there's a conversation of equity, but if we really want to step into justice, that conversation of accountability and reparations and acknowledging communities that have been predominantly impacted by bad policy needs to happen. And so when we talk about acknowledging folks that we need to consistently keep at the table that have been directly impacted, that's one thing, but if we're not also thinking about the ways that policies need to continue to reinforce the supports that those communities need to acknowledge historical hurt and pain and struggle, we're not achieving the full mission of health justice.
I just feel like I need to speak for like a younger person, a person that's in these communities that we're talking about, and a person that's on like the lower end of public health. I'm a CNA at a hospital up north, and I also live on the south side of Chicago. And I just want to talk about some of the stuff that I wrote down. Like the doctor, she was talking about job disparity or whatever, and we have a lot of that on this, in my community on the south side of Chicago. I was saying some of the policies and some of the solutions that we should look at is like, for starters, so don't have a heart attack. Using some of the TIF and other state funding to provide jobs that are beneficial and needed in each community. So it should be like, that should be something that should be on community basis. Like certain communities have certain needs. And a lot of communities such as mine, we don't have a lot of things that we need in our communities. Like we don't have any clinics at all. So like one of the solutions I had was like clinics that support the health problems in those communities, such as high blood pressure, cholesterol, diabetes, HIV, STDs, abortion and parental health clinics, because none of that is really available for us. And along with that, trauma clinics. We all know majority of trauma is on the south side of Chicago because of the high rates of violence and shootings, but we don't have any trauma hospitals in said community. We have to go all the, I think the closest one is Price, which is you gotta get on it, like, you gotta go down a busy street to get there, and then the other closest one is UFC, which is you gotta go through a lot of traffic to get there. It's nothing like really close that can be, when somebody can be life or death. And just along with that, simple walk-in clinics that we're able to get full physicals. I don't have, at 25, I don't have a primary doctor because I don't have, I'm on Medicaid. So I can't go to Aunt Martha's for a full physical. And then along with that, that would be like to support jobs in the community. And then I was thinking about like Uber buses where like a lot of people, she was talking about the transportation problems. And I feel like we should like maybe have private bus systems to take children to school, because a lot of children gotta get on what they call CTAs to go to school, and they're young. Like I've seen a 4-year-old by themselves with another younger kid getting on CTA to go to school. That's not very safe. And like people to get to their doctor appointments, so something like that. And then on the city level, maybe I don't know how many people don't like, but I was thinking like some Chicago public schools should be privatized because it takes away the reliability of governments to support those schools. So like it should still be eligible for grants, loans, and endorsements and donations, but like all along, majority be affordable for impoverished families. And like we gotta understand the children are our future, and they're not being able to flourish because policies cut CPS funding and sad leadership because of such. So I feel like we also need to do mass public health. So like it's a lot of abandoned buildings on the south side of Chicago that are not being properly utilized for homeless, said clinics and all of that stuff. And this is my biggest idea, and I feel like it's a simple idea too. On the state level, we have a lot of deductibles from our check, but I feel like we should do a 401k deductible where it's like 401k is taken out of our check mandatorily, so it can go into the future of our savings. And that's pretty much it.
The impacts of capitalism and imperialism, and how it's affected the structures that we And I think that if we stay rooted with those two spaces and acknowledge that those two key areas influence a lot of the reason that we're at right now, we can start to deconstruct and address that in a more powerful way. Because I think, again, lifting up what the young sister was just saying, like, from that perspective, your voice can be more heard, and the plans that you're putting forth for us can be implemented, which is important to me, because it's not about being right. It's about people working together, building that trust, building that community through time. We are in a big crisis right now, and it's going to require us to think completely differently, especially those of us in this room that I would say benefit from poverty, whether we want to recognize it or not, with careers and salaries, and we're able to bring up our families, but not everybody gets to get that together. And I think about that all the time. So I'm just going to say that, end on that, just to kind of put a big one out there, because I know Dr. Murray will close it out in a good fashion. So thank you for your time.
Wow. Well, give yourselves a round of applause. Let's see, hear for that, because I think you all shared a lot of excellent ideas. Before I hand it off to Dr. Murray to close, again, please leave those sheets, leave your notes behind, whether you put them on that big sheet of paper or on other paper. We want to be able to compile your great ideas into an agenda that we share with all of you, that we share with our aspiring and existing elected officials. And I just want to thank you all for stepping into a space of creativity today. We don't always have opportunities to get outside of our day-to-day and do this, so I want to thank you all for coming and for doing this work together, and I'm excited for the work to come. So with that, thank you, and I'll hand it off to Dr. Murray to close us out.
Let me do some quick housekeeping. We had a lot of food over in the kitchen area, passed there on your way out. Let me ask, if everyone should hand in a sheet or 2 or 3. So if you haven't filled one out, go get a sandwich and sit down and write it out, because we're going to use it. We didn't discuss this ahead of time. We have more over here if you need them. But I'm going to ask the staff to arrange to put this on our website, put this tool on our website, and maybe send out a blast email to our list and ask people to join us in this effort. And I want to pick up on 2 things, especially what was just said a minute ago. I don't want to take a lot of time. The example we had about breast and dense breast, this is a perfect example of trying to work at the detailed level in a setting that's not great. Now, I'm not happy with the state legislature trying to practice medicine, to be honest with you. It's not that I disagree with, sometimes they pass stuff that makes sense in the moment, but it only takes one little advance to deal with dense breast, and I don't think that's the major issue. That's not the major reason why we have a mortality disparity. That's the most important thing. So in general, my attitude is we should be passing legislation and making policy changes at a higher level than individually trying to tell folks what they should be doing. Though I agree they should be advising women what it means to have dense breasts and do something about that. But that's not the major reason we have that inequity. Let me end just with what was said just here. I want to thank everybody for thinking, and I'm going to ask you, it's not just once you fill out the forms, once we send you the email and stuff, have your friends fill out the forms, that's great. But don't forget, you're going to be in a lot of settings, many settings to pass the election, but especially in this time period where people are going to be talking about changing the nature of city council, getting some councilmen in that can think. It's a challenge. Technically we have a strong city council, mayor form of government. I don't know if you all realize that, but so the mayor really theoretically should be the least important. But so when you're in these settings, ask yourself, when someone brings up an issue, ask yourself, how does that issue impact the health of our community, of our city, of individuals, of our family members? How does it impact unemployment? Begin to be a person that can connect these dots up. That's what we really ask of people that came to this forum. How do you connect an issue that your neighbor has with the issue that you have, with the issue that somebody has across town? How do we show how they're linked together, and how the cause of them are linked together, and how the solutions are therefore linked together? And I'm sorry that I feel bad that I didn't mention capitalism. I thought it was obvious, but let me be clear. When people steal the wealth that we create, that system, that economic system is called capitalism. And we need to address that, and we shouldn't be afraid to talk about it and address it. And so again, it really comes down to the two things I led off with. Everyone wants to be healthy and to feel that they're well. So well-being and health are, I would argue, universal goals. And I hope they become universal human rights, but they're certainly universal goals. And in order to accomplish that goal, we have to have power, so that the wealth that we create collectively gets spent and shared in a way that makes sense. That the least of us, the children, the seniors, especially now that I'm a senior, I like saying that, the elderly, okay, get taken care of first. You don't let a 2-year-old go hungry. We do, the country does, but we shouldn't. So in order to have power to distribute the resources of a society and to protect the earth, we have to have democracy. Not only democracy within this city, democracy, we have to actually have the 1965 Civil Rights Movement, Voting Rights Act mean something. We've lost ground on that. So find a way to connect those issues. In a few weeks, we will enter 2019. That marks the 400th years since slaves were first brought to this country. 400 years. It's an anniversary worth remembering well. It's a history that still lives with us. The capture of the hemisphere, genocide committed on the indigenous peoples of the hemisphere, and the importation of slaves from Africa. That's why we have immigration from the South. That's why there's immigration from Africa and the Middle East into Europe. So the time has come for that history to be held, the people who did that to be held accountable. And that means that we have to know our history. We have to be willing to say that everyone on the planet deserves the same basic human rights. And in order to guarantee that, we have to have structures that allow us to take the power from the people that have it and redistribute it to the people who need it. So with that spirit in mind, and let me just say in the spirit of Brother Harold Washington, let us go forth and make this election mean something. Thank you.